In Victoria, that is 41 new cases since our update yesterday. I'm sad to have to confirm that there are now 675 Victorians who have passed away as a result of this global pandemic. That's 9 since yesterday's report. These include 1 female in her 70s, 1 female and 3 males in their 80s, 1 female and 3 males in their 90s. 8 of those 9 deaths are linked to female and 3 males in their 80s, 1 female and 3 males in their 90s. 8 of those 9 deaths are linked to female and 3 males in their 80s, 1 female and 3 males in their 90s. 8 of those 9 deaths. There are 2,403,388 test results have been received since the beginning of the pandemic, which is an increase of 12,938 since yesterday. They'll be essentially results from Saturday tests, so that's a number that's broadly in keeping with some of our weekend numbers we've seen in recent times. Again, every single Victorian who's got even the mildest of symptoms, please come forward and get tested. It's so important in terms of us tracking where the virus is and then being able to hit the targets that we need to hit in order to safely open up without that risk that we don't have a complete picture and that we're not responding to the virus in the most precise terms. It's very challenging, it's very dynamic of course, but the more certainty we can bring to this task, then the more reliable the decisions are, the more reliable each of those steady and safe steps are. Any symptoms whatsoever, no matter how mild, please come forward and get tested as soon as those symptoms begin. Stay at home until you get your test result. That's by and large now within a 24-hour period, and it's a massive thing, a massive contribution that each and every person who gets tested is making to the most complete picture of what we're up against. There are more than 190 test sites across the state, and if you've got symptoms and you can't get to a test site, we will come to you. That is so important. There are 4,369 cases in total of unknown source, so mystery cases. That is an increase of 4 since yesterday's report. There are 259 healthcare workers who are active cases, and we send our best wishes to each of them. We thank them for the amazing work that they are doing. The fact they're infected, many of whom will have got it from the workplace, just makes the point that hospitals are high-risk workplaces and this is a wildly infectious virus. There are 1,781 active cases across the state, so those numbers continue to fall, and that is good news. In regional Victoria, there are some 95 active cases in those local government areas under stage 3 restrictions. Again, thank you to every single regional Victorian following the rules, doing the right thing, coming forward and getting tested. These numbers are low and they are being driven even lower because of the amazing work that every single person in regional Victoria is doing, just like those in Melbourne. But when you get to these finer, these smaller numbers, obviously the individual decisions, individual choices become even more important. In terms of Geelong, there are 16 active cases, a decrease of 3 since yesterday, and no new cases. So that's very pleasing given the size of Geelong and some of those transmission risks between the west of Melbourne and Geelong. They are very pleasing numbers. In the show release from this afternoon will provide a 14-day case average for both Metro and regional Victoria, so that I know will be of interest to you and to the broader community. If I could just give you a couple of numbers in, as I always do, in aged care. I don't have disability facility settings today, but as soon as I can provide that, it'll probably be in the show release later today. We have 873 active cases in aged care, 93 outbreaks, and that is a number that's falling in terms of outbreaks as well as active cases. There has been some stability come to residential aged care, and we're very pleased that everyone is working together to drive those numbers down to as low as they can be, given the underlying vulnerability of so many residents in those settings. Now, just a couple of follow-ups from yesterday. The single person bubble will be basically means that a single person will be able to have another individual to their home so long as they are the only adult living there. The person who is supporting them doesn't need to be another person who lives on their own, but the person for whom the bubble is most important. This is directly listening to feedback from people for whom loneliness and that sense of isolation is a very real thing. They are able to have someone come from another household, much like the intimate partner arrangements which have operated now for months. The curfew does apply, but the 5 kilometre limit does not. So much like partners being able to spend time with each other and move freely between each other's properties, when you're together though, that for the purposes of the curfew say, that is essentially your home. So you need to be abiding by the rules that everybody else abides by when they are in their home. This is, I think, a small but an important step when you consider how heavy the burden is on those who live on their own and have genuinely been unable to engage with anybody else. In terms of in-home care for children, another matter that we took on notice yesterday, from the 28th of September, so that second step, assuming that we have cases between 30 and 50 in terms of average cases at that trigger point, we will move to that next step, and consistent with on-site childcare, in-home childcare will also be permitted. There won't be a need for a permit. It'll mirror, in essence, the arrangements that are going to apply from the 28th of September in childcare in broader settings. If there's any further information we can provide around any rules that would apply there, then we will. That obviously is a little way off, but it'll mirror the reopening of childcare without permits, and that'll be of very significant interest to many, many families. There have been some questions in relation to skate parks, and I just wanted to confirm that outdoor skate parks won't be opening until the third step in metropolitan Melbourne, that is. So again, subject to those case number trigger points and the 14-day average, that would be from the 26th of October, and of course that would be subject to public health advice. Outdoor gym equipment in parks will reopen in the first step from 11:59pm on the 13th of September, so essentially next Sunday, and that is consistent with the other announcements we've made in terms of playgrounds. They, I think, faithfully report back on some matters that we just wanted to be very careful with the wording on when the questions were asked yesterday, and we would aim to continue to do that. Wherever we can't give you an absolutely definitive answer, we'll come back to you as soon as we can. Just before I throw to Brett to talk about the epidemiology of the day, I just wanted to do a couple of things in broad terms. I want to thank Victorians for the amazing job that they're doing, whether they be in metropolitan Melbourne or regional Victoria. I wanted to say how proud I am of the way in which Victorians, despite the great difficulty that these restrictions impose, the great challenge that we face, the sense of frustration, the weariness with these rules, we are sticking together, we are looking out for each other, and we are having considerable success. And the best way to I suppose, define that is that on the 5th of August, we had 725 cases. On the 7th of September, we have 41 cases. These numbers are coming down. This strategy is working. We are bringing a sense of control to this, and we will drive these numbers down further so that when we open up in safe and steady steps, we can stay open and we can be together again. We can have a sense of normality, but one that is lasting, one that can be defended, one that can be sustainable, one that can last throughout 2021 until we get a vaccine. So I'm grateful, I'm proud of every single Victorian and the work that they're doing. Without that, we simply can't keep driving these numbers down. Please get tested if you've got any symptoms, and please look out for each other. These are difficult times, but to go from 725 cases to 41 cases in a month, that demonstrates to you that this strategy is working. The sacrifices that we are making, all of us, are worth something. I want that to count, and that's why we simply can't open up as quickly as everyone would like us to. I would like to open up much more quickly than we can, but none of us have the luxury, none of us, not me, not any Victorian, has the luxury of letting our frustration get the better of us and simply saying, I so desperately want this to be over that I'm going to pretend that it is. That's not a recipe for anything other than a third wave. And being open, yeah, for a very short period of time and then being closed down again. That's not a strategy. That's not the advice. That's not what the data or the doctors recommend. And therefore, that is not an option that is available to us now. A steady, safe opening is what we will do, and it will be lasting. And the drop from 725 to 41 in the space of a month is proof positive that this strategy is working, and the many contributions, large and small, are being made across the state. They do count. They absolutely count, and they have to count for something as we move out of this as well. I'll now ask Brett to add to my comments, and then we're happy to take any and all questions you have.
Thanks, Premier. So 41 new cases today, under 50 for the first time since June. So we're at the lowest levels for some months, and with an overall increase of only 36 with the reclassifications. I know people are watching the 14-day average pretty closely now, given that our metrics refer to that. For regional Victoria, it's only just above 5. So I would expect in the 2 weeks from now, it'll absolutely drop below 5, all things being equal, and without significant outbreaks occurring. For Metro Melbourne, that average in the last 14 days has been close to 100, but we have to consider that it was close to 400 only a month ago. So that continues to trend down, and again, in the 2 weeks from now, we could expect it to be below 50 as a reflection of today's number. So absolutely heading in the right direction, but we do still have 1,781 active cases. So again, in thinking about opening up, in thinking about why can't we go to a much more open movement, those active cases are a risk. They all have close contacts. There are still thousands of close contacts being followed up on a daily basis, and we need to bear that in mind when we take those next steps that open industry, that open our movements from our home. Happy to take questions.
What is the Melbourne 14-day average today then?
It's close to 100 for the last 2 weeks.
Just with the dates versus data, I guess, if we get to a point sometime next week where the average is, let's say, 30, do we have to wait until September 28, or we've hit the 14-day benchmark, out we go, change the next step?
For the purposes of certainty, I mean, they are indicative dates because it could not be on track for that. But in terms of the certainty that we're providing, the 28th of September is the opening date for that next step.
But for all those steps, I guess my question is, if we hit the benchmarks that you've set out in the data, the 30 average or the less than 5 cases for 2 weeks, if we hit that before these dates, will we be able to make the next step sooner?
Well, we'll make the following step after 28th of September, potentially sooner, but the 28th of September is locked in for the next step.
I guess, sorry, Brett.
That's a hard date, yeah.
The other ones.
Beyond that, you mean?
Yeah, beyond that. We're talking about 26th of October and the 23rd of November.
Yeah.
Could we get there sooner if the numbers...
Again, there's potential for that. I think we should always be in a process of continuous review. There's absolutely a need for clarity, and in people's minds they need to know, especially from an industry point of view, about some of those indicative dates. But we could miss them on the one hand because we don't get to those numbers. But we should also reflect on being in a much more successful position earlier on and to give consideration to earlier.
But Brett, even September the 28th, if we were able to bring that forward, I'm sure business would be more than happy, wouldn't they? They wouldn't worry about the clarity that you're talking about.
Yeah, I think we need to have September 28 locked in. We've talked about a range of cases that we'd like to get to in terms of an average over the next couple of weeks. But regardless of that average, I think we need to absolutely have that time to drive transmission down so that we're going in the right direction.
Just on the single, I know the Premier just offered some clarity, just a question from some of our readers and viewers. Is the person, if it's a single person, does the visitor have to come to them, or can they go to a house that's full of a family, for example?
Yeah, the movement can be either way, to either household, but in whatever circumstance, it has to be just with that one other individual, unless one of those individuals has young children that can't otherwise be cared for outside the home.
They nominate someone.
Nominated person each week, correct?
No, it's a nominated person for the whole time until we move to a different setting.
Until like the next step, or
Exactly, until the next step.
In terms of enforcement, how do you enforce that? How do you know that someone's not just, visiting one person one week and someone else
We are working on the basis that people have been doing the right thing now in terms of not visiting others. People have been doing the right thing in terms of staying at home as they've been required to do. There is some enforcement mechanism for some of those things, but a lot of it is based on the fact that we know people are motivated to do the right thing and people are doing the right thing. The fact that people who are living alone, single parents, have been calling for these changes is an indication that they've been staying at home regardless of those really difficult circumstances. And so that's an indication that there are many, many people who are just doing the right thing because they know it makes a difference.
Is there a formal nomination process? Like, have you set up some sort of process where there's an official?
No, there's no formal nomination, but this is for someone to bear in mind that whoever they nominate is that person until we move through to the next step.
How confident though can you be that no one will exploit this?
Oh, you can never say that no one will exploit this. You can never say that about anything in this regard, and we've still got people who are doing the wrong thing occasionally. But overwhelmingly, people are following the rules, and I think people understand that it's a risk if you go beyond what these restrictions allow. If you were to change the person that you see on a weekly basis, this is still where transmission happens. It happens within the household, and it happens when people, in a sense, have their guard down and are sitting close together and talking. It is a risk of transmission, and that's why we've taken baby steps in terms of this, and why it needs to be a single person, a single nominated person through the whole step.
Just back on the reopening dates, I suppose October 26th is probably the one that people are most looking forward to because that's when the curfew ends, that's when the stay-at-home restrictions end. Are you effectively saying that if we get the numbers down more quickly, there is a possibility that will be brought forward? Yeah,
I think we would always go through a process of review, that we wouldn't say different circumstances shouldn't lead to a relook at how we're tracking and the risk of moving to a different stage. I think the clarity is important, but I think, as you say, everyone would welcome an earlier opening rather than a later one. I just don't want to, be giving that promise in advance of knowing how we're tracking.
And do you foresee things getting quite difficult, even if we don't sort of bring things forward? We're going to hopefully have a situation where we've only got, under 10 cases a day, but people are, locked in their homes and under a curfew. Do you foresee difficulty in having public support for that situation?
Well, I think we'll have opportunities for people to meet others. We'll have small outdoor group gatherings that allow people to see others, not just for exercise purposes, but for other recreational purposes. I hope people focus on making the most of that, but recognising that going beyond that does increase the risk, and it does put everything at risk in terms of what the next step might be and getting on top of these numbers.
And how much is people's mental health factored into the decisions you've made? The sentiment around town today seems to be that people who were otherwise optimistic are feeling a little bit flat at the prospect of, such a long road ahead.
It is a long road ahead, and it's not easy from a mental health point of view for anyone. And so I think we've always been cognizant of what it means to have these restrictions in place. Equally, what's the alternative? Because we've done this modelling to understand what it would mean to lift at an earlier point in time, to lift at different numbers. And going into another lockdown, I think, would be even more devastating from a mental health point of view. No easy pathway here, the same across the world. Unless you've eliminated it completely, you really are playing that balancing game of trying to minimise the restrictions in place, but not put at risk everything that we've gained over the last month, which is very substantial.
What have you done as the government? You've done, Brett, on specific industry risks. Retail is closed for some time, but there doesn't appear to be much evidence that they've been a place of high contagion compared to, say, abattoirs. Why not take that into account when looking at these measures? There
are certain outbreaks and clusters that are really easy to identify. They happen in an explosive way. The workplaces have a fixed population of workers, and we can see that a huge cluster or outbreak has occurred. And meatworks are a case in point, distribution centres, other warehouses with significant numbers of people. So we see that occurring. In a retail setting, people are mobile. There are thousands and thousands, tens of thousands or more moving through on a daily basis. And I'm sure the risk of transmission is there. They're indoors, people get in close proximity, but we can't identify them as outbreaks because those individuals will go back home and they've been to one particular retail setting, but they've also been shopping for food. They've also gone out for medical care, emergency purposes, etc. And so we can't always identify the transmission in those places. And I'm sure a lot of those retail settings would say, well, we've never had an outbreak identified with our setting or with our chain of stores. But the risk is there, especially if it's indoors, especially if people gather in large numbers and are in relatively close proximity. So I'm sure transmission's occurring, and that's been a consideration in terms of just bring down the volume and the movement of people in those tens, hundreds of thousands that we know retail occurs.
Considering a public register where people could log on and see where there's been outbreaks, also maybe see where people have been asymptomatic 24 hours before testing positive, is that something that Victoria is considering?
Well, the case data at a postcode level is available on a daily basis, active cases and at a local government area level as well. We have also published in recent weeks those exposure sites where we know someone who's been infectious has been to. And again, it may not be that they're close contacts, but we're listing those exposure sites for casual contacts to reflect on the fact that if they do develop symptoms, they should get tested and to just have a real awareness of the fact that those individuals have moved through some of those areas. That's happened in the Latrobe Valley in the last week, for example. So we're doing that. There aren't many instances because we're down to very small numbers and people haven't moved much. And so a lot of the work is just in identifying their very close contacts that have just been their household and work contacts. And so there's no other information to publish. But where it's relevant for those casual contacts, we are putting that up on the DHHS website.
Why is the roadmap for regional Victoria all the same? People in the North East are saying, why do we have to wait till Colac to get their case numbers down in order for us to open up?
Look, there really is a risk of creating bubbles in regional Victoria that just drive other people to move to those settings, to go to a place where they can go to restaurants or where they might be able to go to a pub. Cabinet's talked through this at length. I think there was, real consideration about how to make it work. But we're also cognizant that even if you haven't had a case for months, the movement of people for essential reasons brings a risk of seeding into any one of those places. And if you've got different settings across regional Victoria, then that risk is heightened. Obviously, we've talked about Geelong and surrounding local government areas as having greater mobility to the western suburbs of Melbourne, where there's still active cases, but they're doing very well at the moment. And so I think, fingers crossed, Geelong's on exactly the same setting as the rest of Victoria.
So just on that strategy, are we trying to still live with the virus or get rid of the virus? Given some of the targets you've set for steps 3 and 4 rely on limited or zero new cases or transmission.
We are just trying to have a pathway where we can be assured that we're not going to be stepping backwards in weeks or months to come. If that means that community transmission ends, terrific. We'll have an even greater level of confidence that it's not going to go backwards. But if it's a controlled, very small number of cases that we can keep suppressed over weeks and months, then equally that's a decent place to be in. It does carry some different risks because as long as there's community transmission that's ongoing, there's that greater risk of it surging or outbreaks occurring or super spreading events occurring. So getting rid of community transmission altogether is probably preferable, but we won't let that hold us back as an aim if we get to very low and controllable levels that we can maintain stably right through.
Just on that, zero community transmission is the aim. Has that been achieved anywhere else in the world when we've had almost 20,000 cumulative cases?
I'd say that it's been achieved across the other states and territories of Australia.
They did have almost 20,000 cases.
No, not with 20,000 cases necessarily. But there are only so many island states in the world, and you really have to have closed off international travel to even make it an aim. So, you know, that's not something being pursued across North or South America or Europe or much of Asia. It's a possibility in those entirely closed off countries, if you like. So New Zealand has pursued it, Taiwan's pursued it, and they've been successful in that regard. Iceland's another example. But it's not even feasible for countries, you know, like European countries where free movement of people is ongoing. They wouldn't want to try and pursue it.
There are a number of experts who have analysed the evidence of stage 3 and say basically that was working in reducing community transmission. Did you consider going back to stage 3 with masks, and if you rejected it, why?
Look, stage 3 was making a difference. It was a very slow road, and the effective reproduction number came just below 1, and it would have been a really long haul if we'd stayed in stage 3. What it would mean for us to go to stage 3 now is unclear, but I think we've got a setting at the moment that is going to take us to an opportunity to ease restrictions at a much earlier level. Again, there are considerations in Cabinet, and the Premier can speak to it, around what it means for industry and what it means for the economy. But from a public health point of view, stage 4 has driven down transmission much more substantially than stage 3, even with masks, was doing.
Did you discuss the epidemiological basis? Can I just ask this
Sure.
very quickly of you? Did you discuss the epidemiological basis of this with AHPPC at any stage before announcing the roadmap?
We were talking through the principles in HPPC. We've spoken of the principles of aggressive suppression right through, because it's a national cabinet decision that came up through HPPC as a strategy paper. So the epidemiological principles underlying aggressive suppression are absolutely in HPPC's mind, and it's been an ongoing topic of discussion for weeks and weeks.
Did you discuss, I guess, these actual specific, you know, this specific roadmap with them?
Not this
announcing it?
specific roadmap for Victoria, because no one's got a view of the Victorian industry and population and epidemiology to the extent that we do ourselves. But obviously the principles of getting that effective reproduction number down as low as possible and driving transmission down to levels where we know that we can sustain it in the long term is something that has been spoken of at HPPC. I'll be updating them in a couple of hours on the roadmap to talk through it and to have reflections from them in terms of how they see it and any other advice they'd give. We're always open to those conversations.
You're now going to be using
Sorry,
artificial
one more from you.
intelligence.
Sorry.
At the beginning of the pandemic, we obviously relied on international experience to inform our understanding of the virus.
Yeah.
Now we've got Victorian data. What does that tell us about how the virus has spread through the community and also where our weaknesses might have been?
We still look to international data. I get an update with a literature review on international developments on a weekly basis from our intelligence team, so that's still part and parcel of our reflections. But obviously in stage 2 we've got very detailed information around where transmission has occurred, and in lots of ways we shouldn't be surprised at what's been borne out here. We know, again, from international experience, the specific high-risk industries. I think it has clarified for us in Victoria that outdoor activities are a substantially lower risk of transmission, that there's a particular risk in chill rooms like abattoirs in terms of the virus sustaining itself for a longer period of time and travelling further between people. We certainly know that the evidence on masks is becoming stronger and stronger for the community use of masks, and I think that's a change that we moved with the international evidence and WHO guidance on that. But we've also found out the challenges in the aged care sector. Again, not new from international evidence, but I think it does speak to the very substantial vulnerabilities in that sector and the fact that we need to consider each and every one of those vulnerable sectors and make sure that we're addressing that from a preventive point of view as much as possible.
You're now using artificial intelligence in contact tracing. Has that started?
I don't know if it's kicked off yet, but the intention is absolutely to trawl through that free text to look for connections that might otherwise take a lot of person hours to dig into, and anything it can add is of value.
The tender that closed for that a few days ago, is that for an updated system, or is this for the first time that kind of technology has been used here?
We've used artificial intelligence in different ways in the communicable disease space in Victoria, but for this specific purpose, focused on coronavirus and focused on the work that's in our database is new.
Are other Australian jurisdictions using that sort of technology before now?
Not that I know of. Not that I know of.
What do you mean the free text? Can you just explain a little bit more how the AI works?
I don't know the full details, Simon. I'm happy to look into it. Yeah, there you go.
When a long form interview, which can take an hour or more, is conducted with every single positive case, and we're getting well into the 90% within 24 hours, they will obviously provide the background about where they've been, their circumstances, how long they were symptomatic for, all of that detail. Now, those documents are read, but to go through them again and again and try and find connections that might not necessarily be obvious, no matter how many times you read them, is just the best use of tech. So from that, and it's not just a sample, it's trying to do this across all of those interviews, and also, Simon, looking back at interviews that were conducted some time ago, trying to find patterns that from even a week or a month ago might be instructive in terms of what we could face next week or the week after. So it's nothing more complicated than that.
Has this been developed only for the first, like Brett just said, you think no other states are using this sort of thing? Is this
we can
developed specifically now for the COVID pandemic?
Yeah.
Okay.
So, well, I'll put it to you this way. AI as and machine learning, whatever term you want to put on it, has been used in these types of settings before for other viruses, other issues. We're happy to. We will ask whether others are using anything like this, and we'll come back to you with an answer. But in any event, I think ours will be as bespoke for the issues we're dealing with as it possibly can be. So it'll be a unique product in many ways, anyway.
When will it start being used?
Oh, I think it's already started being used, but I'm more than happy to come back to you. I haven't got a actual minute by minute on that, but I'm more than happy to chase it up for you.
Premier, business?
And I'm sorry, just before, and I would also make the point that there's the use of every bit of technology we can find, and that's really good. And then at the same time, there's lots of old-fashioned stuff, literally knocking on people's doors and making sure that they're there. And if they don't answer their phone, going back and door knocking them again. So it's a real mix of both high tech as well as just common sense, old-fashioned stuff. And when you bring those together, that's why we can say, I haven't got today's number, but it'll be published, or if not, I'll get it for you. It's certainly well into the 90% in terms of 24 hours interview for all cases. And then we're very, very close to 100% in terms of the close contacts being contacted within 48 hours. So it's not one thing, it's a combination of all those things.
And is it only just become available now, or has it?
I would need to. We've used different IT platforms, different tech, if you like, all the way through. But I suppose part of that. You heard me say many times that there's a culture of continuous improvement. I don't think that even artificial intelligence will necessarily find us 6 hours, but even if it finds us 30 minutes, or if it finds us a connection that wasn't necessarily obvious to us, then that's a good thing. And I certainly wouldn't rule out in the weeks and months to come, if there's some other product or if there's some other change, whether it be high tech or low tech, that we can do to make contact tracing even better again, we would absolutely do that.
Premier, businesses say that they weren't properly consulted about the roadmap, they were just told what was going to happen. When you had meetings last week with industry leaders, what did that achieve and how has their concerns been reflected in the roadmap?
Well, look, I think it's not necessarily accurate to describe the fact that many sectors didn't get the answers that they were looking for as them not being listened to. We have done as much as we possibly can. There's 100,000 plus people going back to work quite soon, and the mix of that and how that will work in very practical terms has absolutely been informed by very detailed discussions. I know there are a lot of businesses, a lot of sectors, a lot of peak bodies who did not get the news they wanted yesterday. I understand that. And it's not, and again, I'll be really clear about this, it's not just about profits, it's about their people as well. They're concerned about all of those things. If we could have provided a different series of steps, more things open faster and done that safely, then of course that's what we would have done. But we will continue this week, for instance, to consult with a very wide range of stakeholders, a very wide range of businesses, particularly those who are worst affected by these necessary steps and the safe and steady nature of them, particularly in relation to the type of assistance that they will need. We're not going to just do that without speaking to them. We're not going to do that ourselves. We're going to speak with them about the types of help, the types of support that they believe would be of the greatest benefit.
So you're open to feedback and you'll potentially change this plan?
Well, this plan will be driven by the data and it'll be driven by the doctors, and there's no other way. There's no other way. And, you know, the question was asked to Brett a little while ago, why can't certain retail settings that have had no cases? Well, no cases we know of, that's the first point. And secondly, it's not so much about the shop being open, it's about letting all the customers out of their homes, hundreds of thousands of people, to go and shop there. We've had this discussion a few different times now over many months, that if everyone who can mount an eloquent argument that they don't have a safety problem, that they're safe, if you agreed to every one of those pleadings, and a lot of them, they are emotional, they are eloquent, they are motivated by only the best things. But if you said yes to all of those, everything would be open. And we wouldn't have 41 cases today. We'd have an awful lot more than that. You know, we shouldn't lose sight of the fact that France has had 25,000 cases in the last 3 days. Spain, who opened up at about 100, 200 cases a day, they're at the 8, 9, 10,000 cases a day now. So the UK, 64% increase in daily cases from yesterday to today. It gets away really quickly. And then you're in a situation where, well, what levers have you got to pull then? What strategy would work then? Well, you're back again faced with this really terrible choice that you can't leave it open. You've got to shut it down again. That's not what we want. We want to get out, move out of this, defeat the second wave, safe, steady, open and stay open. That's the aim. And that does mean that not every business, the answer cannot be to every business yes. Because if it were, then yes, they'd be open for a short period of time, but they'd then be closed again.
Freddie, what economic modelling have you done on this roadmap? And I guess what have you done to ensure that we get maximum health gain, but also minimum economic pain?
Yeah, there's a very substantial analysis done, particularly in relation to the split of those 101,000 workers. And that's not an easy task, obviously, because you've got to weigh up public health risk. And that's as much about aggregate impact as it is individual sectors, although there is an individual sector element to it. And then it's about what's the economic dividend and how much can you open, how quickly, without compromising the entire settings and the strategy, and what's that worth? How much economic activity does that drive? So that's why construction is about 30,000 workers. There are different settings for the different, because it's not just construction, there are different parts of that sector. Then none of those are operating at 100%, they're all less than 100%. Manufacturing, of course excluding meat and seafood processing, is about 29,000 workers make up that 101,000. Wholesale trade is about 21,000 workers. And then of course there's childcare, which I think account for the balance, together with, that's 20,000. Postal and distribution, excluding supermarkets and chilled distributions, about 1,000 workers. And then the sole operators in relation to garden maintenance and landscaping, those type of workers. I actually don't have a number on that. I think from memory it's in the band of about 4,000 to 5,000. You might have been doing the maths as you ran through, but that's 101,000. You can cut that lots of different ways, but the principle that's guided it is what's the lowest public health risk, not just business by business, but in aggregate terms as well, for the maximum economic gain. And they're not easy choices to make. In terms of broader economic modelling, broader impacts of these restrictions and the only option to defeat the second wave, and that's a steady, safe one, not something that can be done in just a few weeks, there'll be more of that, more contemporary data come to that over the course of time.
And
Sounds
on
great
the
about the
meat
target.
industry, Premier, is the 33%, all those rules still staying in place, or is there any change to the output of meat?
They remain in place largely. Those settings remain in place for the foreseeable future, but we're in active discussions. Obviously, the further into spring you get, this is a seasonal industry, so there will be some direct impacts there.
Is there a step, though, that the industry can look towards for when things might change?
I think we're still finalising some of those discussions, and it is quite unique. So what's happening in an abattoir boning room that deals with lamb as we come into spring, those who might deal with veal, for instance, as we get right into the middle of calving season, all of those things change. And when I can bring that all into one complete picture, I'm more than happy to come back to you. But we are speaking very directly with beef, lamb, poultry, pork, seafood, all of them, so that we can do what's necessary to manage the risk, but also what's necessary to keep the shelves stocked, not necessarily with every product you want, but with the products you need. And I want to thank people across that industry for the work they've done. We've seen standards have lifted, compliance has lifted. Those high-risk workplaces are operating probably at their lowest risk rating ever. And that's why we've not seen further outbreaks. But we can't be complacent there. We've got to keep going. When I can paint a more complete picture on that, I'm more than happy to come back.
60% of our active cases are currently aged care or health care settings. Did you consider a more targeted, ring-fenced approach to that to allow the rest of, I guess, the economy to open up a bit faster?
Lund, it's a really good question. It's being posed by lots of people. I would just say this. Firstly, we have got a ring fence around aged care. We haven't got people working in multiple sites. We've got PPE compliance at the highest level it's ever been. We've got basically a task force that meets multiple times a day, works side by side, different governments, private sector, public sector, all of us working together as one. So it's not like aged care is operating at anything like a normal level. They're under a very different set of rules, and they absolutely need to be. We have seen that, and I think that there's work going on at the moment. I'm happy to try and get you an update on it. There's work going on to go and visit every single private aged care facility across the state to make sure that we've got a really clear picture of just how ready they are and what any underlying risk that might be there. It might be something very good for us to come back to you on. In terms of this broader issue about, well, what if you potentially had harder settings there, could you open up more elsewhere? I think we've all got to accept the fact that nurses who work in hospitals and personal care workers who work in aged care, they all live in families. They move. They go from one part of Melbourne to another. Community transmission is very difficult to just attribute and just lock down to one particular setting. The other point that's kind of linked to this is the notion of, oh, well, why weren't you more nuanced? Why don't you lock down suburbs? As hard as these lockdowns are, there are still people that are going to work. There are still people that are moving around. There is still movement. Not everyone, but there is still significant movement. So unless you were going to say to postcodes, say a dozen postcodes in the north and the west, for instance, okay, literally no one can come in or out. No one. So not police going to work, not nurses, not doctors, not retail workers, not list goes on and on, then that's not, in fact, a hard lockdown or the notion of take them to a very different place and then everybody else can do whatever they, what we all want to do. That will not work. We just don't think that will work. Patterns of movement, any exemptions that you provided, and they're pretty limited, but they're exemptions that are based on need. That means you've got movement, and therefore you've potentially got the transmission of the virus. Particularly, and when you really think about it, those areas that you would be locking down because you've got the highest number of cases, the margin for error in terms of people and the likelihood of people moving in and out of those zones taking the virus with them is obviously highest. So that's the thinking that basically sits within that.
How soon will business get their rescue package? And are you consulting with business?
Yes. So there's a whole series of different discussions that started yesterday. There'll be further work, not just with peak bodies. That's very important to engage with them, of course. But there'll be lots of meetings, lots of discussions. And as soon as I can have more to say about that, I will. We know and understand that the announcements yesterday are not what many businesses wanted, but that's the only option for us to proceed in a safe and steady way and get open and stay open. We will have more announcements to make, and we will be as quick as we can be, but we do have to give businesses, I think, that very direct opportunity to feed in about the types of assistance they want, because it may vary one sector to the other. It may vary in terms of timeliness. They might want different support at different times. All of those things are being done, but we'll do that as quickly as we can.
Do you expect that to have Mr. Morrison about extending JobKeeper in particular? I know it's meant to go down soon.
Yeah, I've not had that conversation with him.
Would you like him to consider retaining it?
Yeah, look, Nick, I understand why you asked the question. But my approach to dealings with the PM is very much, if I need something, I'll ask for it and I'll have a proper discussion that's respectful of the fact that I don't think it's necessarily the best thing to lobby the federal government from this podium, but I'll continue to talk with him about lots of different issues, and I'd be confident that we will continue to receive the support that we need.
On businesses, I understand that the extent of the government briefing was last week a Monday night virtual meeting with 155 industry representatives and 2 speakers, one being Martin Kula, but no questions were allowed. How have you been able to listen to businesses if they couldn't even ask questions?
Well, I think you need to appreciate that whilst you may have accurately described the very first meeting, there are then lots of meetings that happen after that. Lots of phone calls, lots of... I'll tell you what I'll do. I'll try and get you a number. I'll try and get you a number of exactly how many specific discussions we've had with not 1 or 2 and 150. That's a very low number. We will have had literally thousands of phone calls with people from across the entire Victorian economy. I think that the fact that a meeting with 150 people on it didn't necessarily give every one of them an opportunity to ask a question was just a logistical issue. But there's then been many, many hundreds, perhaps even thousands of phone calls and engagement by officials, by people in my private office, the Treasurer's private office, Martin's private office, the list goes on and on. So there's been an enormous amount of effort put into that. Now, that's not to say that business received the news that they wanted, but that's a different thing to not being listened to. I would reject that. That's simply wrong. And we will continue to engage in good faith, give people a hearing, make sure they understand what we're doing and why. But I can't guarantee that every consultation provides people with every answer they want. That's not the nature of these things.
Darren, the CEO of Vecchi, who's historically had quite a good relationship with your government, he's even appeared at these press conferences, said yesterday that it was plain to see that business had been misled by the government in the briefings last week.
Well, with the greatest of respect to him, I don't think that's fair. At the same time, though, I don't expect him or many of his members to be pleased with the challenging circumstances we face. He's got a job to do, and it's not to be a cheerleader for the government. It's to be a passionate advocate on behalf of his members, and that's exactly what he does. And that's why we have a very good relationship, and one that I don't think will be in any way impacted by commentary made by him and others yesterday. We will continue to work respectfully in a partnership to get the best outcome we can.
Premier, can I ask you about hospitals first, then schools?
Yes.
When are you looking at easing some of the restrictions on elective surgeries in hospitals and also visitors to hospitals?
Yeah, very difficult.
Well?
Sure. Very, very difficult for us today to paint a complete picture in relation to elective surgery. As you know, Category 1 surgery is still happening. Urgent Category 2, so the more acute Category 2, that is happening. This is both across public and private. There are significant limits that have been put on there. No one's pleased about that, but the sickest patients have to be treated quickest. That's a principle that has always guided us. And you've got to create enough capacity in beds and theatre time so that, time across the system, so that you can cater for those who are needing to be hospitalised. As the total number of people in hospital comes down, as cases come down, then we will be able to move back to reintroduce some elective surgery.
Are there thresholds?
No, it's not like we've sat down and said, okay, well, cases have to be at a certain number. That's not finalised yet. And what we'll do, Simon, because it is a very good question, I know it'll be of very significant interest to a lot of people, including many that work in our hospitals as well. When it's safe for us to start that again, we'll outline a plan, and that will also include a really significant elective surgery blitz so that we can catch up on the time that we've lost, so that we can get back into that position where we are doing more surgery than we've ever done. That's been our record, and it's very, very important.
And schools,
Yes.
how will Victorian
Hospital
students-
visitors, just on hospital visitors.
Oh, yeah, sure.
Let me come back to you on that. It's not a question I've asked recently. Of coronavirus in Victoria, that is 41 new cases since our update yesterday. I'm sad to have to confirm that there are now 607. It's not a question I've asked recently.